Hello, beautiful people. It's Steffi B, and I'm here to study with you guys and get ready for those comprehensive exams, ATI exams, right? So this is part 2 for comprehensive practice questions, right? If you guys didn't see part 1, you guys should see it. And there's going to be a part 3, part 4, and part 5, right? So this is going to be all material on information that we need to know. All right, so let's go ahead and let's get started. Question number 1. A nurse is planning care for a client who's receiving heparin to treat deep vein thrombosis of the left lower leg. Which of the following interventions should the nurse include in the plan of care? 1, maintain the client on bed rest. 2, restrict the client to 1 liter of fluid per day. 3, place cool compresses on the edematous area. Or 4, elevate the affected leg. And the answer here is number 4, elevate the affected leg. So why is that the answer? Let's look at the question. What are they asking us? They're asking us, which intervention should the nurse include for a plan of care for a client that's receiving heparin and they have a DVT? Let's look at number 1. Do we want our client to be on bed rest? No, we want to encourage our client to get up and ambulate, right? We don't want them to sit still and have their blood pool. Right? We want their blood moving and flowing, right? If they sit in one area and the blood is pooling, they're at a higher risk for developing a pulmonary embolism, right? So their clot can travel to their lungs. Number 2, restrict the client to 1 liter fluid per day. No, we do not want to restrict fluid. We want to encourage them to drink fluid, 2 liters to 3 liters per day, right? We want to prevent platelet aggregation, right? And prevent dehydration. Number 3, place cool compresses on the edematous area. We want to encourage warm compresses, right, to the affected area. So that's going to reduce swelling and promote comfort, right? Because warm compresses helps vasodilate the vessel, right? So the answer is 4, elevate the affected leg. So you want to elevate the egg that has edema, right? So it's going to reduce swelling and it's going to prevent the risk of chronic venous insufficiency, right? So if you elevate the leg, it's going to help blood flow back to the heart, right? Our veins help blood travel back to the heart. Arteries are A for away from the heart. So the answer here is number 4. Number 2. A nurse is assessing a client who has stage 2 pressure injury. Which of the following wound characteristics should the nurse expect? 1, muscle damage. 2, partial thickness skin loss. 3, visible subcutaneous tissue. Or 4, tendon exposure. And the answer here is number 2, partial thickness skin loss. So let's look at the question. What are we looking for? We're looking for a stage 2 pressure injury. Let's look at the options. So number 1, muscle damage. So what pressure injury would we see muscle damage? In a stage 4, right? Number 3, so visible subcutaneous tissue. We would see that in a stage 3. Number 4, so tendon exposure. We would see in a stage 4, right? And then number 2 is the correct answer. So we would see partial thickness skin loss or blister formation in a stage 2 pressure injury. Number 2. Number 3. A nurse is providing client education to a postpartum client who has decided to bottle feed the newborn. Which of the following instructions should the nurse include in the teaching to help prevent the discomfort of engorgement? 1, allow the newborn to breastfeed temporarily. 2, relieve pressure by expressing milk daily. 3, place ice packs on the breast for 15 minutes several times per day. Or 4, sleep with a loose fitting bra to prevent nipple stimulation. And the answer here is number 3. So place ice packs on the breast for 15 minutes several times a day. Why? Let's look at the question. What are they asking us? They're asking us, which instruction should we include to help prevent discomfort of engorgement? Right? Let's look at number 1. Allow the newborn to breastfeed temporarily. So if we're having engorgement, so our breast is full of milk or fluid, do we want to allow our newborn to breastfeed temporarily? Will that help the discomfort? No, it'll probably lead to more engorgement, right? Because you're stimulating the nipple. You do not want to do that. Number 2, relieve pressure by expressing milk daily. Same thing. So you don't want to express milk to prevent further milk production, which would lead to engorgement, right? So we do not want to do that. Number 4, sleep with loose fitting bra to prevent nipple stimulation. So we want to wear a tight fitting bra that's supportive, right? So that would help the discomfort, right, of engorgement, right? So the answer here is number 3. You want to put ice packs for 15 minutes several times a day, right? So that's going to help reduce swelling, right? And then that's going to help with the pain that's caused by engorgement. Question number 4. A nurse on an inpatient unit is caring for a client who has schizophrenia and recently tried taking risperidone. Which of the following actions should the nurse take? 1, implement fall precautions for the client. 2, monitor the client's thyroid function. 3, place the client on a fluid restriction. Or 4, discontinue the medication if hallucinations occur. And the answer here is number 1, implement fall precautions for the client. Why? Let's look at the question. Let's see what they're asking. Let's see what we're given. So they're asking us, which of the following actions should the nurse take? So this client has schizophrenia and they're on risperidone. So let's look at number 2, monitor the client's thyroid function. We're going to want to monitor their CBCs, right? So they're at risk for anemia, thrombocytopenia, leukopenia, right? And they can also have elevated liver enzymes, right? So we want to check that. Number 3, place the client on fluid restrictions. No, we want to encourage their fluid intake because they can be at risk for constipation and dry mouth. Number 4, discontinue the medication if hallucinations occur. No, so hallucinations are an expected manifestations of schizophrenia, right? Risperidone is an antipsychotic medication, right, to treat positive symptoms of schizophrenia, right? So we do not want to discontinue it, right? So the answer here is number 1, implement fall precautions, right? Because risperidone can cause orthostatic hypotension. It can cause them to be dizzy, right? So that can lead to falls. So we want to implement fall precautions. All right, next question. Number 5, a nurse in an outpatient mental health clinic is caring for 4 clients. The nurse should recognize that which of the following clients is effectively using sublimation as a defense mechanism. 1, a client who transfers their anger about their job onto their family and then apologizes. 2, a client who misses provider appointments because they say they're too busy. 3, a client who channels their energy into a new hobby following the loss of their job. Or 4, a client whose partner died 4 years ago sets a place for them at dinner each night. And the answer here is number 3, a client who channels their energy into a new hobby following the loss of their job. So let's look at the question. We're looking for a defense mechanism of sublimation. Let's look at the options. Number 1, a client who transfers their anger about their job onto the family and then apologizes. So what defense mechanism is this describing? So this is describing displacement, right? So it's not sublimation. Number 2, a client who misses provider appointments because they are too busy. They are rationalizing, right? They're too busy, so they can't make their appointments, right? So they're just having an excuse for why they can't do something. Number 4, a client whose partner died 4 years ago sets a place for them at dinner each night. They're in denial, right? They don't want to admit or accept that their partner passed away. So they're still putting a placemat and their food for the partner, right? So they're in denial. Number 3, a client who channels their energy into a new hobby following the loss of their job. Yeah, so this person is channeling negative feelings over the loss of their job into a new hobby. So that is the definition of sublimation. That is an example of sublimation. So here the answer is number 3. Number 6. A night shift nurse is giving change of shift report to the day shift nurse on a client who's ready for discharge. Which of the following information is the priority for the nurse to communicate to the oncoming nurse? 1, the client needs assistance when transferring from bed to wheelchair. 2, the client will have a visit by a home health nurse tomorrow. 3, the client's partner will bring clothes for the client to change into prior to discharge. Or 4, the client often needs encouragement to engage in personal hygiene activities. And the answer here is number 1. The client needs assistance when transferring from bed to a wheelchair. So why is that the right answer? Let's look at the question. What are they asking us? So they're asking, so which information is a priority that we want to tell the oncoming nurse, right, during shift change? We want to tell them the way that they transfer the patient, right? So it's important to tell them how they transfer from bed to wheelchair, right? Because they're at risk for falls, right? We do not want to have this client be at risk for injury. If we look at the other options, it's not a priority, right? So if we look at number 2, the client will have a visit by a home health nurse tomorrow. Yeah, that's tomorrow, right? So it is important to know that information, right? It will affect the client's care at home, right? But that's not the priority, right? Number 3, the client's partner will bring clothes to the client to change into prior to discharge. Great, right? Not a priority. It's good to know though. Number 4, the client often needs encouragement to encourage in personal hygiene activities. Yeah, that's good information to know as well, right? Because it affects the care the nurse gives the client. But there's another answer here that is a priority, right? And that's number 1. Number 7, a nurse is teaching a group of guardians about child safety measures. Which of the following statements by a guardian indicates an understanding of the teaching? 1, I will make sure my 4-year-old child wears a helmet when using a skateboard. 2, I should have my child avoid sun exposure between 10 a.m. and 2 p.m. 3, I can give my 2-year-old child a whole hot dog on a bun. Or 4, when my infant is in a carrier, I will place it on a raised, flat surface whenever possible. And the answer here is number 2. I should have my child avoid sun exposure between 10 a.m. and 2 p.m. Why? Let's look at the question. Let's look at the information we're given. So we're looking for safety measures for a child. We're looking for a statement that shows us that this guardian understands safety measures. Let's look at number 1. If this guardian says, I'll make sure my 4-year-old wears a helmet when skateboarding, does that show that they understand the teaching? No. A guardian that understands the teaching would not allow a 4-year-old to skateboard because they are not able to protect themselves, right? So they have to be 5 years old or older to be able to skateboard. Number 3, I can give my 2-year-old child a whole hot dog on a bun is a choking hazard, right? So you want to make sure that the hot dog is cut lengthwise to prevent choking. Number 4, when my infant's in a carrier, I will place it on a raised, flat surface whenever possible. That sounds like a risk for it to fall, right? So you want to make sure that you avoid placing the carrier on an elevated, high surface area where it's at risk to fall, right? So number 2, I should have my child avoid sun exposure between 10 a.m. and 2. Yeah, you want to apply sunscreen, right? And dress the child to protect them from the sun, right? Between the hours of 10 a.m. and 2 p.m. Good job. Number 8, a nurse assessing a client who has decreased visual acuity due to cataracts. The nurse should identify that which of the following physiological changes is the cause for the client's visual loss. 1, an increase in the intraocular pressure. 2, deterioration of the macula. 3, increased opacity of the lens. Or 4, vitreous hemorrhage. Here, the answer is number 3, increased opacity of the lens. So why is that the answer? Let's look at the question. Let's see what they're asking us. They're asking us which physiological change is the cause for a client's visual loss, for a client that has cataracts. Is it 1, increase intraocular pressure? No, right? Because that's describing glaucoma, right? So when you have glaucoma, that's going to cause mild headaches and foggy vision. Number 2, deterioration of the macula. That's describing macular degeneration. Okay, and that's going to result in decreased central vision. Number 4, vitreous hemorrhage. That is bleeding and damage of the retinal blood vessels, right? So that happens when you have uncontrolled diabetes or hypertension, right? High blood pressure. Number 3, increased opacity of the lens. Yes, that is correct, because when you have cataracts, that means that you have cloudy lens, right? So it doesn't allow light to penetrate through your lens. So opacity means the inability to allow transparency, right? So when you have increased opacity, that means that you have increased cloudiness, right? No transparency, a lack of transparency. All right, so the answer here is number 3. Number 9, a nurse on a pediatric unit has received change of shift report for 4 children. Which of the following children should the nurse assess first? 1, a 6-month-old infant who has CROP and an O2 saturation of 92 on room air. 2, a 15-year-old adolescent who has 2 hours post-op following an open reduction and internal fixation of the left ankle and is requesting pain medication. 3, a 3-year-old toddler who has gastroenteritis, moderate dehydration, and had 2 loose bowel movements over the past 24 hours. Or 4, a 10-year-old child who is awaiting surgery for an appendectomy and experience sudden relief from pain. Here the answer is number 4. A 10-year-old child who's awaiting surgery for an appendectomy and experience sudden relief from pain. Okay, so why is that the answer? Let's look at the question. So the question is asking, so which child should we assess first? So when we look at the options, we're gonna look for what's expected and what's unexpected. Let's start with number 1. So we have a 6-month-old infant that has CROP. The O2 saturation is 92. Is that expected or is that unexpected? That finding is expected. A child who has CROP will have an O2 of 92. So that's okay. We don't have to see that child or assess that child first. Okay, number 2, a 15-year-old adolescent who is 2 hours post-op following an open reduction internal fixation of the left ankle requesting pain medication. Is that expected or unexpected? That is expected, right? Requesting pain medication after a procedure is expected, right? You're going to have pain. You're going to want to treat that pain, right? But there's another answer that's more important. That's going to be a priority. Number 3, a 3-year-old toddler who has gastroenteritis, moderate dehydration, and had 2 loose bowel movements over the past 24 hours is expected, right? Somebody who has gastroenteritis will be dehydrated, right? So that is expected, right? And if we look at number 4, a 10-year-old child who's waiting surgery for an appendectomy and then has a sudden relief from pain is unexpected. Why? Because this is describing peritonitis, right? So a sudden relief from pain can be describing an appendix rupture, right? They were in pain and then all of a sudden there's no pain, right? So we want to see that patient first. We want to see what's going on, right? So that's the first person that we want to see. We want to notify the provider immediately. Number 10, a client is receiving lorazepam IV for panic attacks and develops a respiratory rate of 6. and a blood pressure of 90/44. Which of the following medication should the nurse anticipate administering? 1, naloxone, 2, flumazenil, 3, acetylcysteine, or 4, atropine? And the answer here is number 2, flumazenil. Why? Let's look at the question. What are they asking? They're asking us which medication should we administer, right? So this client comes in, they're having a panic attack, their respiratory rate is 6, their blood pressure is 90/44, right? What do? And they are receiving lorazepam IV for a panic attack. Let's look at number 1, naloxone. So we give naloxone for an opioid overdose, right? Such as morphine. So number 1 is not correct. Let's look at number 3, acetylcysteine. We give acetylcysteine for acetaminophen overdoses, right? So that's not correct. Number 4, atropine. We give atropine when there's a cholinergic inhibitor overdose, right? So such as neostigmine. So that's not correct. Let's look at number 2, flumazenil. We will give flumazenil, right? To reverse the sedative effects of lorazepam, right? So we would give that medication, right, for a benzo. All right, so number 2 is the correct answer. All right, guys, we are all done with the 10 practice comprehensive questions for part 2. There's gonna be a part 3, part 4, and part 5. All right, if you didn't see part 1, watch it. And guys, good luck. Thank you for studying with me. If you like the video, like it. If you want to leave a comment, leave a comment. And guys, good luck. All right, love you. Bye, beautiful people.